It gives me tremendous satisfaction as a care of the elderly physician as well as the medical lead for home care in Edmonton zone to speak about an initiative we have embarked on to support family caregivers in the community. It is well recognized that family caregivers now are the shadow workforce in our society and they are the backbone of our healthcare system. However, this backbone needs support. Family caregiving comes at tremendous physical, mental, and financial cost to the family caregivers. It is time to build a better system around them.
When we did get to the point where we needed home care to come in, I was pretty stressed. And it would have been very, very helpful to me to have caregivers that came in and did what I needed to make sure my mom's quality of life was there.
We engaged a stakeholder advisory group and we looked at what are the areas that we want to focus on. We determined we were going to focus on respite for caregivers and we were going to look at instrumental activities of daily living. And how could we enhance those and perhaps make a difference for people to stay in the community. We have developed 4 pilot teams to help us to look at what is the right target population for this work.
With that in mind, we are implementing an initiative in home care based on 5 years of research and stakeholder engagement. This initiative includes health workforce training based on caregiver-centered competencies, identification of family caregivers needing supports, assessment of their needs, as well as functional supports for care recipients and flexible and timely support in the way of respite for family caregivers. Our measures of success are going to be threefold. 1 is to reduce caregiver distress as well as improve their health and well-being. 2 is to improve healthcare workforce satisfaction and increase their confidence in supporting family caregivers. And 3, helping care recipients stay at home.
My name is Maria Morazzo, and I had the privilege of taking care of my disabled mother for 5 years in our home because of the Enhancing Care in the Community program. Having her in our home meant that we were able to keep our family unit together.
I have experienced firsthand the increase in hope and satisfaction for caregivers and clients during this process, which has really been a positive for both myself as a clinician and for the families who see this service as something that's really beneficial and essential to them staying at home. I feel that I've been given the tools to provide the best client and family-centered care possible.